Good morning, Tony Maritato here, licensed physical therapist, and in this video I want to answer some questions from the Facebook support group, and specifically Sandra was asking, quote, "Can't stand for bedding to touch your incision, question mark. I put a big pillow under the covers beside the knee and it holds it away." So if you guys can visualize this, and Sandra, that's a great option. She's created like a tunnel. She's got one, maybe two pillows on either side of the knee that are keeping the comforter, the sheets, the bedding up in the air to create a little bit of space so that it's not touching the knee, the incision. That's a great option. For others, another great option, there's a video out, it's got like 200,000+ views. I'll post a link in the description of this video. A gentleman who had a knee replacement, he's not a therapist, but he found this solution, and I've heard this from other patients. He has kind of two options. One is he places paper towels over the incision, then he wraps the incision with saran wrap to create kind of a barrier between the knee and the bedding that would be rubbing it or catching on it. He also talks about rubbing a lotion over the knee, a hypoallergenic lotion hopefully, and then wrapping it again with saran wrap. The big concern with any kind of lotion is the possible introduction of an infection. Even if there's just a tiny little pinhole opening in the skin or some sort of vulnerability, putting anything on the knee is going to be there's a risk to it. There's always a risk. So these are certainly viable options to help you feel better, like right now, if you need to sleep and it's driving you crazy. I know a lot of patients who simply just place the leg outside of the bedding. The sheets, the blanket, the comforter is covering the rest of their body and their leg is just kind of hanging out to the side. That's totally an option. But ultimately the goal is to desensitize the incision, right? So as long as this incision is sealed, as long as it's far enough out, usually this would be about a 3 or 4 week time frame, that the skin is closed. Maybe there's a scab or two, but generally speaking, the skin is closed. There's no seepage, there's no sign of infection, there's no sign of irritability in there. This is where we want to start working on what we call desensitizing. And there's lots of ways that you can do it. So some people will use a dry, clean washcloth. They'll simply gently rub over the skin on the sides of the knee and then come over toward the incision. You can use a tapping technique. So if I have an incision on the knee and I just use my fingers to kind of tap along the incision, tap on the sides of the incision. I've got another video, and I'll try to link to it, where I talk about cross fiber massage. So if the incision is running vertically without lotion, I'll use the friction of my skin to go over the incision and just move horizontally perpendicular to the incision back and forth. You can also move parallel with the incision. The goal is we're trying to loosen the skin, because as your body's healing, it's laying down the scar tissue for the skin vertically, horizontally, diagonally. It's kind of like a cobweb effect, and what we want to do is we want to try to realign some of those fibers so that we can maintain the mobility, at least of the skin. This is a separate discussion from the mobility of the deep joint, the joint capsule and connective tissue below the skin. We're just talking about the skin right now. So anything that you can do to work toward desensitizing that skin, the clean washcloth is a great option. Tapping on it, cross fiber massage, any of those are going to work really well. Multiple short episodes throughout the day seem to be best. I would never tell somebody to do 10 minutes once a day if they could do 3 minutes 5 times a day. That's a preferred method. And then introducing the stimulation that normally bothers you, but not doing it at night, right? Nobody wants to be messed with at night. We want to let Mama Bear get some sleep. That's all that matters. But during the day, if you know you have a sensitive incision, if you know that the blanket, the comforter bugs you, if it's 10 a.m. in the morning and I'm at my peak of feeling good, I'm going to sit in a recliner, maybe wear a pair of shorts, put some blankets and sheets on top, and just let my body get comfortable, get used to that sensation, because that's what it is. It's a sensory condition that we want to desensitize. As always, guys, thank you so much for your questions. Your questions help me produce better videos to help other people who might not know about our support group on Facebook or might not even know about our YouTube channel. And if you want more information, go check out my blog at totaltherapysolutions.com/blog. I'll catch you guys on the next video.